randomized clinical trial of intraosseous methylprednisolone injection for acute bulbitis pain. It is done by a group from Dakar University led by Bane and colleagues, and it is published in the JOE in 2015. So bulbitis is a common dental emergency, and it is typically managed by emergency bulbotomy or bulbectomy. However, in this article they wanted to evaluate a pharmacological approach for the emergency management of symptomatic irreversible bulbitis. So the aim of this randomized clinical trial is to compare the effectiveness and the safety of intraosseous methylprednisolone injection with the emergency bulbotomy for managing acute bulbitis. So patients were recruited from University Dental Hospital at Dakar University, and they included teeth that are diagnosed with irreversible bulbitis of a permanent premolar or molar with a healthy periodontium and no regional or general health condition contraindicate either bulbotomy or prednisolone injection. Then a randomization list was pre-established. Each newly enrolled patient was assigned to a treatment group by the blinded investigator. So they had a total of 94 patients that were randomly assigned either to the full bulbotomy group or to the experimental group with intraosseous methylprednisolone injection. Regarding the experimental group, after the local anesthesia, the injection point was decided in the attached gingiva, around 5 mm below the cervical line, away from the dental roots. Then the cortical bone was perforated using X-tip, and the guide sleeve was left in place for the injection of the methylprednisolone of 1 milliliter in 1 to 2 minutes. And on discharge, patients from both groups were prescribed an analgesic prescription of ibuprofen 400 mg or acetaminophen of 500 mg. And a data collection form for recording the pain experienced during the 7-day waiting period before definitive treatment completed, where the spontaneous and the percussion pain intensity were assessed on a 4-point scale, with 0 indicated no pain and 3 with severe pain. Then after the 7-day waiting period, patient received the endodontic treatment and restoration of the affected tooth. They found that immediately after the treatment, both spontaneous pain and percussion pain were less intense in the methylprednisolone experimental group, and during the 7-day waiting period in the experimental group, less percussion pain was reported by the patients and spontaneous pain tended to be less intense. And in the control group, the percussion pain and the spontaneous pain decreased from day 1 to day 4 and leveled off afterwards, while the spontaneous pain in the experimental group was diminished at day 4. Also at day 7, it was noted that both the spontaneous and percussion pain were less in patients in the experimental group. So the findings of this study suggest that methylprednisolone injection appears to be effective as an emergency management of acute irreversible bulbitis pain.